Hello. It is said that the only two things in life that are unavoidable are death and taxes. Today my speech will be on the right to die. We will discuss two types of this form. First will be PAS, which is physician-assisted suicide, and that is when a doctor prescribes a lethal dose of medication to a patient and the patient self-administers this drug. The second is euthanasia. Euthanasia can be defined as the intentional termination of life by someone other than the person concerned, at the later's request. This is from the Belgian Euthanasia Act of 2002. Advocates for PAS believe that patients have the right to choose. Opponents say that this devalues human life, that they can live longer than doctors predict, and that they suffer from undiagnosed depression, and this affects their decision. Now, in the article, The Last Choice by Josh Sanborn, September of 2015, he discusses a California anesthetologist and cancer patient. This patient, Dr. Daniel Swangard, and his fighting to defend the legal rights of terminally ill patients who want to die on their own terms. According to this article, California passed a right to die bill on September 11, 2015, which allows doctors to prescribe life-ending medication to terminally ill patients. In the published article, Euthanasia, Discussion Before Decision, Collier, January 6, 2015, states that euthanasia is now legal in Quebec, but doctors whom are taught to do no harm are having trouble complying with the law and dispensing medication to end life. While in another publication, Euthanasia by Frederick and Fischhauser, January of 2014, they asked the question, does all life have value? Should we fight death when suffering is unbearable? Should financial concerns ever be a consideration? In my opinion, I don't want to leave bills behind for care I did not want, and it changed nothing. In the end, I still died. While all of the opinions expressed in these articles can only make us think about the topic, unless you or a loved one have faced this choice, you may have problems understanding why someone would choose to die. I believe this action is not an easy decision, but the final choice should be the patient's. There are 4 states in the U.S. that have legal PAS: Oregon, Washington, Montana, and Vermont. While the majority of people believe that it should be legal, doctors on both sides of the issue are still arguing. Some doctors believe in palliative care. Palliative care is a multidisciplinary approach to specialized medical care for people with serious illnesses. It focuses on providing patients with relief from their symptoms, pain, physical and mental stress of a serious illness, whatever the diagnosis. Palliative care doesn't always relieve the pain, and doctors give more pain medication until the patient is in a drug-induced coma. At this point, it is too late to choose PAS. There is no quality of life, and because of machines and drugs, there can be a lot of quantity, yet is it living or merely existing? Some suffer horrendous pain. Others lose bodily function. Many are put into nursing homes. These homes warehouse them. Pain medication can be given late, and patients may have to sit in their own feces because staff members are too busy to be of use to the patients. I know a woman that was in a nursing home. She had MS, as do I. She was confined to a wheelchair with no expectation of ever leaving it. She could not care for herself. She made a choice to travel to Detroit to see Dr. Kevorkian, or as he was known by his other name, Dr. Death. She ended her life. Some people ask how she could do such a thing. I said that it was her choice and we should respect it. If the time comes that I face a nursing home, I hope PAS will be legal so that I can avail myself of this choice. My father-in-law was diagnosed with bone cancer, which is one of the most painful cancers there is, as every time he moved, he broke bones. It was terrible to see how this strong man became weak and lost weight and lost his will to live. He was prescribed a morphine drip, and he was able to control how much morphine he received. He was sent home to die. It is not proven, but many believe that he overdosed and ended his life and ended his suffering. So if you are diagnosed with a terminal illness or disabling health problem, remember that you had a choice to do something about it. Did you? Can you? Will you? Contact your legal representatives and let them know your opinion before your choice is unavailable. Thank you.